Good morning. My name is Amy Wheeler, and I'm here with Becky Deano. And Becky lives in Louisiana in a small town called Mandeville outside of New Orleans. And I just want to tell you a little bit about Becky before we get started. Because our topic today is how does yoga therapy fit together with mental health and where are they the same, where are they different, how can they be used together, this type of thing. And so I'm so happy to have Becky here. She is one of the faculty for our Optimal State of Living mental health training program, which we start again in January. And Becky is just so fantastic to be on our faculty because she has a master's degree in counseling of depth psychology at a master's in counseling and depth psychology at the Pacific Graduate Institute. And she completed that around 2000. And she has also got basically a license from the state of Louisiana as a professional counselor, an LPC. In addition, she has been trained since the early 2000s in the tradition of Krishnamacharya as a yoga therapist. So she's got this beautiful marriage of both of these things happening. And she has some specialties. She's worked with a lot of veterans, and she's worked with people who have cancer. And she is a co-owner of a yoga studio that focuses primarily on therapeutic yoga. So welcome, Becky. We are so happy to have you here. Thank you for coming this morning.
So happy to be here with you, Amy, and everyone else.
Great. So I kind of want to outline where we're going to go together in this talk today, because I think it could be of interest to therapists who want to know more about yoga therapy. It could be of interest to yoga teachers who are wondering if they want to go into yoga therapy. It could be of interest to yoga therapists, because I think the field of yoga therapy is still so new that we're really trying to understand what it is that yoga therapists do, what is their scope of practice, what are they not allowed to do, where do they overlap with mental health professionals? Where do they need to make sure they don't go? So I want to kind of give a little introduction to that before we get started today, and then get into the kind of the depth of yoga therapy and mental health therapy, and really kind of go deep with you, Becky. So I'm so happy you're here. So the first thing that I want to kind of say is that the way we were taught is that yoga therapy is complementary. It's complementary to allopathic healthcare. It's complementary to mental health care, either a psychiatrist or a psychologist or a marriage and family counselor. And we don't think of ourselves as the person holding the case. If someone has schizophrenia or bipolar or anxiety or depression, we, at least in my practice, and I know we've both been taught this, we will make sure that that person actually also has a mental health care provider. We are not going to be the primary provider of care. We're going to be the complementary provider of care. So do you want to say anything about that, Becky? Because I think you of all people would be an expert on this.
Yeah, well, I do have a couple of psychiatrists that refer to me, and that's exactly how we work it, is that they will refer their clients mostly with anxiety and depression, and they will do their processing with them. The trauma part will be worked with their psychiatrist, or some of them even have a therapist, a psychotherapist, and they come to me for their practice to help them get into balance, so that then when they are doing their work with their mental health provider, they're in the best state that they can in order to do that work. So
I love this. Okay, so this is number one. And we saw this in several talks at the SITAR, the IYT annual conference last year in June. And basically, we are defining yoga therapy as that which brings the human being into balance on multiple layers of their human system. Physical layer, breath layer, mental layer, possibly personality, emotions, that we use asana, pranayama, meditation, some visualization, possibly some chanting, depending on the person. We use these yoga tools, lifestyle management techniques from the ancient yoga texts and Ayurvedic texts, to get someone into balance so that they can do the work with their psychologist or do the work with their psychiatrist. Because it's really hard for, you go to your psychologist once a week for 1 hour out of the whole week, and the rest of the week you're completely out of balance in your body, mind, and spirit. It's tough. But if you have a yoga therapist that's giving you a daily practice that's setting you into balance and setting you up for success, your time with your counselor or your psychiatrist is probably going to go a whole lot better. Do you agree with that?
I definitely agree with that. And the other thing is the relationship between me and the other providers, so that we will have some idea of what's going on and when we're noticing that something's off. And so it's really helpful to have a different set of eyes on some of these clients who, they may be suicidal, and they may be going to them once a week. They may be coming to me once a week, and we can kind of keep an eye on them pretty well. And they really like the daily practice. The other mental health providers really like the idea of this daily practice that's going to help them to be getting back into balance each day, starting their day in that way, of having some idea of where they are.
Yes, it's self-accountability, self-empowerment, and let's also be clear that it's not just any yoga practice. We don't say, yeah, get up and do 30 minutes of yoga. We don't say, get on Yoga Glow or some other online platform. Can you tell us a little bit about how it is that you design a practice that's very specific to that person to help them get into balance, not just a general practice?
Yeah, so that really starts with the assessment of taking a look at who's in front of me and taking a look at how they're looking on the physical level. What's going on? Where are their imbalances possibly there? And taking a look.
Let's unpack that first, because that alone is amazing. Right? I watched myself walk by a mirror the other day, and I was like, what is up with that posture? Right? So what are some of the things you might look for on the physical layer when you're assessing and designing a practice?
So I may look at one shoulder might be a little higher than the other, and has that moved down into the hip area? If I have them lying down, I can see if one foot is maybe longer than the other to see where that might be, because you want to find out where that is coming from. We're not just looking at the symptom. We really want to get back down to the cause of what's caused that. So I may be looking at their skin and whether there's any rash to the skin, or if there's color there. Is the prana moving easily within the skin and within the body in that way? I may look at their nails and see how their nails are looking, and their eyes. So there's all kinds of things on what can I see physically in them that is going to give me a hint as to what might be going on and where they may be imbalanced.
And this is just to say that in the traditions of yoga and Ayurveda, we have guidelines for all of this. It's not that we're going into a skincare specialist that's a medical doctor and trying to diagnose a skin rash, but basically it gives us information about what's happening in their system. Same thing if one shoulder was higher than the other. It's not that we're trying to be a physical therapist, but it gives us information about what's happening in their system. Now, if any of these physical symptoms looked pathological, of course, then you would refer back to the skincare doctor or back to the physical therapist. We are kind of taking a more global look at the whole human system on the physical level, and just noticing where the small imbalances might be, right? So then we go to maybe the breath level, or what some people might call the vitality level, the physiological level. What are some of the things you would look at to assess your client on that layer?
So one of the things that I'm looking for is, how is their breath? Is it smooth? Is it long? Is it short? Is the inhale and the exhale, one of them longer than the other one? Are they just breathing up in the clavicle area, or is their breath going all the way down? So those are the things that I'm looking for. And I may ask some questions about things that might be on, how are they sleeping? Things that can be related to that physiological layer,
Or even digestion.
Digestion,
Well, yeah. If you found that they told you, oh, I have terrible IBS, you would be referring them out to, someone that can really deal with digestion. So again, we know that we're complementary, but yet what they tell us gives us a very nice idea of what's happening in their system, so that when we help to write their daily practice, we actually do it appropriately. right?
Right, exactly. And like you say, if their shoulder is lower on one side than the other, I'm certainly not about how are we going to fix that. It's just going to be about how am I going to have them moving in a way that is going to not make that worse, but possibly be able to balance that out for them.
Beautiful. And then we also assess them on the what we call the manomaya, the kind of mental or the intellect. What are some of the things you might look at for that assessment?
Yeah, so maybe whether they're having racing thoughts, whether they are able to keep focus, how the conversation is going, both in terms of how they're reporting it to me and in terms of what I'm seeing in my conversation with them. How's that going? Where are the places? Are they depressed? What's going on in their mind? So that's pretty much what I'm looking for.
And if you saw anything major, you would refer them to have a psychologist or a psychiatrist, but at the same time, there's a lot of information we can get. And in yoga therapy, we say how they knock on the door, what their emails are like as they're leading up to a session with this, how fast they talk, like all of it gives us an idea of what's going on in their body, mind, and spirit, right? So it goes back to those ancient texts that we have information that maybe a psychologist or a doctor or a PT or a dermatologist, they're looking at it from a completely different lens. We're looking at it from the lens of how is the prana flowing, is the system seeming to be in balance, that type of thing.
Yeah, and I want to say that I try as best I can to have as open mind as I can, but I'm also looking for confirmation on these different levels of what I might be seeing that might be saying the same thing too. So it's not about trying to fix any of these disease pieces. It's much more about looking at where the imbalance is, looking at confirmation for imbalance on different levels, and looking for where maybe they are imbalanced on different levels, because the practice will be different based upon that.
Right. So that's interesting because, in our yoga therapy and mental health training, we actually clearly define, according to the ancient texts, what does someone look like when they're out of balance and what does someone look like when they're in balance. And we go through all these layers of the human system and really try to train our students who come to our programs. What does a in balance human being look like? You don't see it very often. So we are trained to see, that's what out of balance looks like. And this is what in balance looks like. And I'm going to design a daily practice to start bringing them closer to being in balance. Yeah. So when it comes to the next layer, we call this the personality. We also could say it's having to do with your communication, your perception of the world. It's called the Vijnanamaya layer. And we say in our tradition, and I think a lot of other yoga therapy traditions say this also, that the relationship that the client or student has with you is one of the primary healing tools, that we can understand quite a bit about that human being by observing our relationship together, but we can also use our relationship to help create more safety, more security, the types of things that a lot of people who are out of balance actually need in their life. Do you have anything you want to say about that?
Absolutely. And psychology, of course, says the exact same thing. It's most of the studies that have been done on this will say it's not the technique that's going to matter, whether you're going to be doing Jungian or Freudian or whatever you're going to be doing. It's the relationship. And the sutras speak so beautifully to this in chapter 4 about the heart-to-heart connection. That's where the transformation takes place. It's that heart-to-heart connection, which not only is that connection between the teacher and the student, but is also that bringing you into your own relationship with yourself, your own heart-to-heart relationship with yourself, which is what the psychotherapist is doing also, where the client will then internalize that voice themselves. That's part of the healing, where now it's self-empowering, that they've learned how to go out and do that themselves so that their relationships will be better because they've had that experience.
Well, and let's give an example of in yoga therapy, the way that we do that is we might give them a daily practice that, helps loosen up their shoulders and helps steady their mind to get a one-pointed focus. And then by the end of the practice, possibly they get into a very deep state of stillness where they can actually check in with themselves and feel the sensations in their body and have some realizations about how they act in the world, how they, what their life purpose is. You know, when you get to that really quiet place, you start to get to know yourself better. I just had my second class yesterday with my kids at Cal State, and I saw it happen in class number 2. I was like, wow, 35 kids completely still for 10 minutes on day 2. And I was shocked. And I thought, well, how is this different, you know, yoga class versus yoga therapy? And the difference is in you know, it's a miracle that happened yesterday. Usually when you're in a yoga class, the class may or may not work for you that day, right? I must have gotten lucky yesterday. But in a yoga therapy practice where the practice is designed just for you, I think people can get to that point where they're really silent and connecting with themselves maybe 60 to 80% of the time. What do you think?
Yeah, and I think I agree with that. And I think that part of it is that on the days that they're not, they now know that that is a day that I am not in balance. And it gives them some information about how to interact with people that day or what to have their expectation to be. And maybe I can do the practice. It wasn't working so well for me right now, but maybe this afternoon I could try it again, and or at least parts of it that work best for me, and see if I can get myself in balance. So they start to learn to see when they are in balance and aren't in balance in some way also, which I think is very helpful.
I love that. And that's really the heart of our yoga therapy training, is recognizing when we're in and out of balance. And then the beautiful thing is that your students or clients start to learn, when I'm out of balance like that, here's the kind of practice I need to do for myself. And here's the tools Becky taught me to bring myself back. But when I'm out of balance in that direction, well, those tools aren't going to work. She gave me that other practice. Oh, okay, that's the one I'm going to use today. So a lot of times people end up with a little notebook of practices. Here's my practice when I'm in a rage. Here's my practice when I feel completely depressed. Here's my practice when I feel anxious. And we get a little file full of tools and techniques to help bring us back into balance from the many different states that we might be in. So it's not really a general yoga practice. It's, these tools work for me when I'm anxious.
Yeah, and I think, the other piece to it is there are times that the practice that I design initially is not the right practice because I didn't see something. Or you can have two people and you may think that it's similar, but it's not, because you weren't able to really see the cause of it. You were only able to see the symptom, and you had to then kind of, figure out what the cause might be. And so maybe it's not the perfect practice, but that is also a great way to kind of hone in for them to be able to ascertain, look, this piece is not working. Can we do this? And then when they can see, wow, it's just that little shift in something. It's amazing how that can shift me that much by doing something so simple as changing my breathing with regard to, my meditation or whatever it might be that we shifted.
I love that. And it goes to one of the main tenets of yoga therapy, that we're not treating the anxiety, we're not treating the depression, we're not treating the trauma, because if that was the case, we would always use the same breath patterns, same postures, same meditations for anxiety. And we don't do that. You might have two people with anxiety that have completely different practices because the way that they need to reduce their anxiety is totally different. So this person might have these 5 tools and this person might have these 5 tools. Even though their symptoms look the same, the causes of their anxiety and the tools that work for that person are very, very specific to the individual. So I love that. And I think that is very different. When we look at therapeutic yoga for anxiety, it's kind of saying, these tools are likely to work for anxiety. And I think that's great. That is true. But when you really have one-on-one yoga therapy, you have the opportunity to say, did those tools really work for you? And somebody might say no. And I'll give you an example. A lot of times when you ask someone with anxiety to focus on their breath, it actually increases their anxiety. So we might give them a breath technique and think, yeah, that's the breathing technique you do for anxiety, long exhale breathing or something. And then they come back and say, that did not work for me. And in fact, it made it worse. So then we as the yoga therapist have to go back and say, okay, what's really going on here? What tools or techniques can we give them? Maybe we do some nyasam, exhale, 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 inhale, inhale, inhale. And then we go to the next finger. Maybe we do something slightly different that still has a long exhale associated with it, but we gave them something to do with their hands, and now it works for them. So, all right, so let's go to one of the last layers, and that is, some people call it the emotional layer. Other people call it more the spiritual layer, the Anandamaya. And again, we're talking about assessing that as well as trying to help someone come into balance on that layer. What do you want to say about faith and faith in yourself, faith in something higher than yourself? I know this is one of your favorite topics. It's more of the spiritual aspect of what we're doing for those clients who are willing, because not all of them want to go there, right?
Right. Not all of them want to go there, but you can always find something that works for people that they, for so many of them, it might be nature, or it might just be a place where they feel in their most calm and certainly doesn't have to be a deity. It certainly doesn't have to be religious at all. It can just be where they feel the most calm, the most connected, where they know they're the most in balance. And so I just try and seek out whatever that might be and work with that, because it never leads you astray, that if you're able to get them into that place and having that feeling, they're going to be connected. For some people, it may take them further somewhere else. For some people, that's where it's going to be. And everybody's individual, and totally respect where they are on that path. But everyone is grateful for the ability to find that place for themselves and have their practice reflect that for them.
Yeah, I had a client many, many years ago that we were talking about when did you feel the most calm, the most safe, the most connected to yourself and something larger than yourself. And she said, honestly, what comes to mind when you say that is that I remember as a little girl, when it would be pouring rain, I would sit in my grandmother's lap on the front steps and we'd watch the rain together. And she was a big, cushy grandmother, and I was a little one, and we just kind of sit there. And she said, that's when I felt the most safe in this world and the most loved and the most cared for. So we built a whole meditation with rain in the background as music, and this whole meditative activity around that safety and security that she felt with her grandmother. And it was powerful for her. It really helped her build a new level of baseline safety and security and trust in her life, because she did this 15-minute meditative activity every single day to kind of set her up for success. And that's yoga therapy, right?
Right. And I also, I find that if people have had a few more experiences of finding that place, that a lot of times other things will start to open for them. And it can come as just something so simple as, I know there's something else, but I'm not sure what that is. And what I love about yoga is that it gives us the tools to be able to try and explore that without any judgment, without any rules about how it's supposed to be done. That yoga will give us some ideas and some ways, and time tested. This has been around for thousands of years. It's not like a new age way to connect spiritually. That's not what we're talking about. And so a lot of times for people who, once they found that safety and once they found that place of connectedness, there's a deeper place for them to connect, and yoga allows that. I can't tell you how many people I've worked with who have come out of religious traditions turned off by anything spiritual, and then have been able to reconnect in a different way through yoga. And the way that they connect, and many, many times, is back to their old way, back to what they came in with, but in a totally different and deeper way. And that's one of the things I absolutely love, and I'm so grateful to yoga for, because it did the same thing for me, and I'm super grateful for that.
I love that too. I'll tell you a little story. So I'm the daughter of a Christian minister, and, I was the type of kid that I would, first of all, come in late to church, but then I'd sit in the pew and I'd wait for my dad from the pulpit to see me. And as soon as I thought he saw me, then I'd take off. So I had this love-hate relationship with my religion. I did a number of things that no daughter should do to her father, who's a minister. And into my 20s and 30s, I really was kind of like, I mean, I believe in Jesus. I believe in Christianity. I believe in Christ consciousness. I believe that we are all part of a community that should care for one another. A lot of the tenets I believe in, but the thought of going and sitting in a church just didn't appeal to me. So there was one day after I had learned yoga for maybe 10 years, and I had heard through yoga that usually our childhood religions are deep in ourselves, and that if there's any way to get a new perspective on your religion, yoga might help you do that. But I was kind of like, who knows? So I went into a church and I sat down in the pew and I started hearing the hymns and with the organ music and all that. And without any warning, I just started crying. I just was like, wah! And I was looking at myself going, what is happening to me? And it was exactly what you said. I came in with a new perspective. It was no longer dogmatic. It was no longer, you have to do this to get to heaven. It was some deep connection within myself of the good things that I remember about church, the community, the old ladies who used to bring me gum every week, the people who cared enough about me to help me with my homework, just a lot of really wonderful things that happened as a child that I had forgotten about, that this experience kind of made me realize, well, maybe I could find a community that met those needs, that didn't have all the other stuff I wasn't so crazy about. And it gave me a new perspective.
Absolutely. My husband often says, don't throw the baby out with the bathwater, which is exactly, because I did the exact same thing, kind of threw it all out and then came back in a new and just richer way. So beautiful and so wonderful to walk with others that are able to have that same experience.
And what about if you're like, oh, hell no, I'm a recovering Catholic, or I'm a recovering Buddhist, or I'm a recovering Jew. I am not going back there. Then what do we do?
That's great. I'm all about that. Then we find the place that does connect for them in whatever way that it is. And if that's where they go for the rest of their life, I think that's fine. From my belief system, that's where they're supposed to be at that point. As long as they are in balance and they're feeling comfortable in their lives and their relationships are good and that's their belief system, I'm all about that,
Or atheist. That's fine too. We don't even have to go there in yoga therapy. I mean, yoga therapy says, do what works, do what makes you feel calm, content, satisfied in your life, makes you feel in balance, and there's no judgment one way or the other. If you don't even want to talk about this layer, we don't talk about it. Let's stay with your shoulders. Let's stay with your skin color, and if you have prana flowing, let's stay with your breath pattern. If you want to stay with those layers and get a practice for that instead, we have no judgment about that. In fact, we're thrilled.
Absolutely, totally agree. I have students that are atheists and family members that are atheists, and I totally respect all of that. So, and yoga says the same thing. There's no need. There's absolutely no need, for there to be a belief. It does certainly encourage us to have that strong faith in ourselves. And then see where that.
Think about that, because I think that's one of the most significant things about yoga therapy is this idea of getting to know yourself deeply, understanding who you are, hopefully figuring out what it is that you're here to do in this life, trusting yourself, trusting your own gut. What can you tell us about how yoga helps us to do those things? Because it's remarkable.
Yeah, it is. And, I think we can go back again thousands of years, like, know thyself. It's been in the philosophy forever. What is the real meaning of psychology? The study of the soul. It's getting to know ourselves on this deeper level. Psychology has come now to have some different meanings in some of the different traditions, but that was the original place for us to kind of get to know ourselves. And so yoga is totally about that. Who is our authentic self? And once we're in touch with that authentic self, there's no need for the fear piece. So this faith in ourself that is tied to a lack of fear. When there's fear, there's not much faith. When there's faith, there's not much fear. So we can kind of be able to tell. We have our own little barometer. How scared are we? Okay, what's wrong with my faith? What are my practices that I can do that can help me to ground myself in a way that I can have more faith in myself and have my fear be reduced? So, I think
that. I love that. And I want to say faith or trust in you. Because here's the thing, and this is what yoga teaches, is once you know who you are and you've decided, this is me, I like who I am, this is what I'm going with, I feel it, you can take actions that you normally would be too scared to take and let the outcome go, because you know it's the path for you, even if it doesn't turn out perfectly. Even if it gets you in a little trouble, right? It's okay, because you were true to yourself. Even if you give 110% and you don't succeed, it's okay, because you did what your soul told you to do, right? Which is a very different way of living than looking all around and talking to people and what should I do and how should I do it and do you think I'm good enough to do it? And looking outward, you're always going to be living in fear. It feels so good. I don't know how you feel, but I feel so good to just be me. And it's not for everybody. I'm not for everybody, but that's okay, because I can't do anything but be me.
Right.
You know? And it's through my daily practice that I have found that. And when I start deviating from that, I get sensation. I get somatic sensations in my body saying, don't you dare go out there. You get back in here right now. And the sensations are in my gut, they're in my belly, they're in my throat, they're in my heart, they're, racing thoughts, they're palpitations. There's things that I know now, like as soon as I start to feel that, pull it back, girl. Let's go do a practice. And that's ultimately what we want to teach people in yoga therapy, don't you think?
Absolutely, and that story or how you presenting that says so much about what yoga is, because those are, you got used to having a pattern of knowing that this is me in my own true self, and when you're out of that pattern, you get a little, you can feel it. Whereas before you're doing much of the yoga, you're not real sure of what that feels like, and we're pulled in different directions. And what I love about yoga is that it really encourages us to be able to hear that one voice that's leading us in the right direction, and being able to ascertain what the other voices are. Like, even if that other voice is pulling me and and I'm not feeling so great, it's the agitated one that's telling me I didn't do it enough, or they're going to be laughing at me, or whatever the voice might be telling. At least I know that's the voice. That's not the clear voice. Maybe I can't get the clear voice, but at least I know that. Otherwise, before yoga, I would have just been pulled by that voice, and my day would have been just ruined by it, And so this daily practice of being able to come back to myself, okay, I'm hearing the voice, great. Just like you're saying, I can live my life from that place, and I hope to do that most of the time. But, life is life, and there are days that I am just not living there. But that's I love that about yoga, that it helps us to hone down to that voice more often.
Right. And like you said, having this specifically designed practice for you each morning and tailoring it and tweaking it with your yoga therapist. Okay, that's not working for me anymore. It could be something like the seasons changed. And the yoga therapist knows from the ancient texts, like when we transition from summer to fall, the practice is going to change. The qualities that come with the seasons, you may do a totally different practice in the winter than you do in the summer to keep yourself in balance, right? So I'll just give you a few examples of that. For me, I have a lot of fire in my personality and in my mind, and in the summer months, I cannot do a really hot, fiery practice. It puts me more out of balance. So I do gentle swimming, I do a floor practice, I look like I'm flopping around, legs on a chair, all these very gentle, cooling activities, certain breath techniques that are cooling. But now that we're going into the fall, which is a little bit colder, a little bit more windy, my mind is starting to get a little bit more distracted with all the stuff on my plate as a university professor and all the other things I do. Now my practice needs to change. And so it's through yoga therapy that I have learned, at the different times of year, I need totally different practices. In the springtime, I need to work it. I need to sweat. I need to almost do a workout kind of practice to keep myself in balance in the spring. So this is what I love about yoga therapy, is it's based on these ancient texts from thousands of years ago, but it's still all these ideas about what tools and techniques we should be using are applicable today. I think that's so cool.
I totally agree with you. I think that's so cool. And how much in the Yoga Sutras is very much what's in psychology today. And how now that we have neuroscience to kind of prove what was there before, we're not, and how much we have with regard to trials and research kind of coming up to show us that what these yogis knew was, and I think we're still going to continue to find some of those, because there's some that just haven't even been discovered yet by the scientists. So that part is totally awesome to me.
I completely agree. It's kind of interesting because we have different camps within yoga therapy. We have you must be in a tradition and a lineage, and you must have a guru, and you must follow these ancient teachings and don't ask any questions, just do what those books said. And then you have people kind of in the middle who are kind of like, yeah, I connect to all that ancient knowledge, but I also want to look at modern science and kind of bring the two together and see where the overlaps are and see how does modern science bear out these ancient teachings. So I was having a talk with Shirley Tellis, who's a famous clinical researcher in the area of yoga for postures, for pranayama, for obesity, metabolic syndrome. I mean, she's just done hundreds of research studies to show these connections. And her latest idea of what she's going to be working on is looking at all the ancient texts and looking at the different breathing techniques and seeing if they still apply today, right? So can we even assume that these pranayama techniques, how they worked on the human system 2,000 years ago, the DNA, the way people function in the world, the way our minds function are completely different today. And do those techniques still work on the modern person? I think that's fascinating that she's willing to take on such a huge topic, but also a really interesting topic, and doing literature reviews to see, does Surya Vedana or does Nadi Shodhana or does all these techniques, does that even work today in a clinical setting?
I find that really interesting, but I'm putting my money on the yogis. I'll tell you, I just, too much of it has just been borne out in the practices that we design and that we do, that I'm really glad that she's doing it, because I think it's really great to have the confirmation. But that's what I mean by, I think there are some places where there are things that we know from these ancient texts that even some of those in the medical field and the psychology field are not quite up to. And of course, there's things that they are able to do that we're not able to do. They have they have so many options with the drugs. For some people, that's maybe what they need. The thing I like to do when I'm working with psychiatrists is get the people to the best balance that we can before we start doing the drugs on them, so that we're not drugging things that are just imbalances that can be.
I love that. Now, we would never recommend like, oh, go off your medication or cut it back. We would, as a yoga therapist, never do that. We would just work to get them in balance. And then their psychiatrist or psychologist might say, wow, maybe we can reduce this dosage or something, because they would notice that they no longer needed so much medication.
Yeah, that happens a lot with people who go and they don't want medicine. They don't want to take medication. And the psychiatrist thinks that they do need it, but we'll say, let's see the best we can do without. Let's get you to the best place we can, and then you can make the decision as to whether you're going to. I have that with anxiety a lot, anxiety clients. And, amazingly, sometimes they're able to do it without, or they can just have it as needed, if there's going to be a stressful situation, but they're not having to do it every day. So it just depends on who it is. And of course, some of them need to be on the meds. Absolutely. And I totally encourage that when your psychiatrist wants you on meds, I'm with you there. So.
Right. And again, we probably wouldn't discuss that with them too much, except to say, we're going to get you or help you get into balance. And then you can make those decisions with your allopathic doctor or psychiatrist or something like that. Yeah. Yeah. So let's talk a little bit about some of the other yoga tools and technologies that we use. Some, like even the yamas and niyamas. These are kind of the 10 foundational principles of how do you interact socially in the world, and how do you take care of yourself, self-care practices or disciplines. From my perspective, we might even write a yoga practice around some yamas or niyamas, meaning maybe you have a habit of getting really angry and sending nasty emails, and you keep getting fired. from your work, right? We might teach them something about ahimsa or nonviolence, and nonviolence to yourself as well as nonviolence to others, and make a whole meditation around nonviolence. So have you ever done practices for people around those types of things, yamas and niyamas, instead of just the postures and the breathing and the meditation?
Absolutely. And even woven it into everything else. So, you know, contentment is one that I will work with people who are just not content with where they are. So we'll be doing other things with regard to that. You know, we're kind of like lifestyle. We're aiding in lifestyle in general. And what we're trying to do is get people to the most functional, balanced place that they can be. So I may weave it in with chant, with them chanting. I may weave it in with as they're breathing it in and then breathing it out, even as they're doing their asana. So depending on what's going on and working it into the practice. Yeah, I've done that. And of course, worked with the Kriya Yoga part of.
So tell me a little bit about that, because I think that is huge. This idea that Kriya Yoga has 3 parts to it, and it's kind of an attitude that yoga and yoga therapy suggests that we take in the world for less suffering.
Right. I think it's, you know, it's the first sutra in the 2nd chapter, which is the chapter for those of us that don't have the most calm mind. So for me right there, that's super important. If we can start there, we're well on our way to moving forward. And the idea is for us to be able to do whatever it's going to take for us to let go of those things that are getting in our way of being able to take the action that's going to be the more balanced action for us to take. And then for us to have some reflection about that. Like, am I making sure that the things that are getting my way, I am able to let go of, you know, am I in that place to be able to make the decision of what the right action is to take, and then taking that action and letting go of the results, knowing I've done the best that I could, I've thought about it, it's happened, let it go. And it comes back to the serenity prayer for me, which I think is just so beautiful, you know, which is being able to change the things I can change. And then if I can't, let it go. It's not for me, you know.
So this is where I think yoga philosophy, it's whether you don't have to think of it as spiritual, but you could. But ideas like this that give us food for thought, like, can I take action, make the best decision possible at this point in time, and let go of the outcome, right? That's definitely a Kriya Yoga type of practice that we're going to do. So part of your daily practice might be saying the serenity prayer at the end of your asana and pranayama as a means to say, I am going to do my best and I'm going to let go of the outcome. And that's a totally yogic philosophy or a yogic principle that we might help someone instill into their daily living through their yoga practice.
Right. And for those who are deeply spiritual, it may be a practice of bringing in whatever the divine will might be, and then in their meditation, having their hands out and letting them be doing the divine will back out, and then knowing I'm just acting as a mediary for this, and so it's not mine in any way. So for people who are deeply spiritual, that's helpful for them, you know, because they're giving it up to that higher power for themselves.
Yeah, I love it. I mean, I just really want to demonstrate that in yoga therapy, it's not like we're trying to be a shortcut to being a psychotherapist. We're actually working with yoga philosophy, yogic principles, yogic tools, yogic technologies, through a daily practice that gets people into balance. And then they can do their work with their talk therapist or their psychiatrist too.
Yeah, I think that's really important. And I think part of this, which you've brought to the forefront too, is how we use the assessment tools. We don't use the assessment tools that are in psychology. We use our own assessment tools. And so we keep this
tell us about that, because I actually see, sadly, some yoga therapists going out of scope of practice and using psychological assessment tools, which is actually not going to help the field in the long run. That's not okay. So I really want to talk about that. I know it's controversial, but we as yoga therapists have to stay in our scope of practice. We can't be giving the Beck's anxiety scale and the Beck's depression scale and all these scales to collect data on people. I mean, for research purposes, that's separate. But as part of the assessment as a yoga therapist, we have to be very, very careful that we're not stepping out of our scope of practice, really.
And I think that it's helpful for us because that's not what we're here to do. We're here to get them back in balance. And so the idea is we want to be able to see where are the gunas out of balance. That's what we're trained to do. And that's the part that we need to try and do, is get those gunas back into balance. So what their score is on a test isn't really telling us what we need to do what we're trained to do. So I agree with that.
So the last question I want to ask you, Becky, and I think this is a question that is a little sensitive, but I think you would be a good person to answer it. And that is, what's the difference between if you're a clinical psychologist or clinical social worker, you have your 2 or 3 or 4 year degree in that field and you have a license. What's the difference between borrowing a few yoga techniques to implement into your practice with your clients? Like, okay, I'm going to learn a few breathing techniques, and when I do my clinical, psychological practice and talk therapy, I'll teach them this breathing technique. What's the difference between that versus if someone would want to go the full way and become a yoga therapist in addition to a clinical licensed mental health practitioner?
I'm so glad you asked me that question, actually, because I run into that a lot, because I chose to I started this when I had no idea about doing yoga when I went into my training at Pacifica. I went there because I was very interested in depth psychology and couldn't find it in Louisiana, and so that's why I went there. While I was there, I was introduced to yoga, and then I was able to see, wow, there's these extra tools that I can have in my toolbox. And I wanted to really understand how to use them. And so, and I had someone this week contact me from Louisiana who just finished her training, and she's in yoga school right now, and she wants to be a yoga therapist, and she wants to know, because she wants to really understand how to use them. So you see that there are some people that get into yoga therapy that want to know more about mental health, and some people in mental health that want to know more about yoga therapy. And so I think it's important that we know as much as we can, but there certainly are some therapists who learn at a workshop how to do, maybe they might think that extending the exhale is going to be helpful for anxiety. They might have heard that somewhere. And so they'll try and use that. But like I had said before, you really have to look at who's in front of you, because that may, if they can't extend their breath, then it may make them more anxious. And that person who had a weekend workshop is not going to know what to do then. Like, how am I going to stabilize? What's an alternative thing that I can do? May not even be able to be trained enough to watch the breath to see that they've gotten more anxiety. And maybe the client is not even telling them or doesn't even know that there's more anxiety. So the yoga teacher, I know all of you guys know this, like, we watch people's breath. Like I'm always saying, I'll say, God, they're just not breathing right, and they're like across the room. We're just kind of trained. That's our lens to be able to do that. And it's such an important component of what we do and how we work. And I think it's great that they are interested, those in the mental health field are interested in our tools, just like I'm interested in their tools. And I think that that's why there's communication that's super helpful on both sides. But what I really love about your mental health training is that it will help both. It will help those yoga therapists who want to know more about mental health, and maybe they will realize, I love this so much, I want to go get extra training so that I can then be able to practice either way with either scope of practice. Or the same thing if you have mental health practitioners who, like this woman that I'm meeting with on Monday, who might be interested in taking the mental health training. I think I would encourage her to do that first, and then see, does she want to go the whole route and become a yoga therapist? So I think it's lovely that we have both of these complementary there together, and that we can work with each other. We can gain more knowledge ourselves. We can have communication with other ones, form relationships with the mental health workers in case they have some questions about what's coming up with them. Maybe they can learn a little bit more about how to take a look at the breath, and we would be doing a service to be able to help them to get more knowledge about that.
I just love what you said, is that like with our mental health training that we start in January, there's a lot of yoga therapists out there that actually don't know where the boundaries of the scope of practice are for a yoga therapist. And so our training could help them to understand, like, no, do not go over that line, right? And hone in their skills of what's in their scope of practice. But it also could help mental health care providers understand the depth of yoga therapy, and that it's not just learning a few tools out of the tool basket and you just start giving those to all your clients. It could help them understand like, oh, these tools and technologies from yoga actually have philosophical underpinnings and that they're very, very powerful. And just as you said, if you try one and it has the opposite effect of what you had hoped, then what? Then what do you do, right? Because again, you're not going to treat all people with anxiety with the same breath technique. And in fact, it could work for one person and not for the other. But then what do you do, right? So that's really what one of my main missions is to help these two fields come together, to understand each other, to understand where they're similar, where they're different, to understand that yoga therapy is complementary, but that the clinical licensed healthcare providers also need to stay in their scope of practice and not assume that they can just do a weekend training and be a great, yoga therapist if they want to call themselves that.
Yeah, and what I want to encourage too is that we work together as professionals, that there's not this competition in any way, but that both of us are working for the betterment of the client. And a lot of times for the betterment of the client, to have both practitioners working together is the way to go, and so it's a win-win-win-win. And that's what I'm hoping.
Let's finish on that note, because you said that you have psychiatrists or psychologists refer to you in your work as a yoga therapist. And I think a really big problem right now is that a lot of yoga therapists are saying, I can't get enough work. I need to get more clients and I need to make a living. And so to hear that you have successfully been able to get referrals to do yoga therapy is really inspiring to me.
Mm. Yeah, and I'm doing actually a class for stress that came through one of these psychiatrists to, which is more like just a group class, and we've just started, and those people are really loving this. The psychiatrist is loving that they now have some tools to reduce their stress, and it's possible that some of them would then become individual clients with me, So I think
this is brilliant. This is brilliant. This is creating your own niche. You go to a psychologist or a psychiatrist, you say, let's do a 6-person group class for stress management, which of course they're going to love because who doesn't need that? And then you might parlay that into some individual yoga therapy clients. Sounds great.
Yeah, and the intention here, with regard to that, is to start having more 6-week programs in that same way every so often, one with anxiety, which I've taught several of those, and then with depression, and then and just kind of moving through there so that you get known as someone who is working within the mental health community doing yoga. And so I think the professionals will pick up on that a little bit too. So that
and you do have the bonus of being licensed. However, I know plenty of people that are not licensed mental health care practitioners that are doing things like this. And they're doing beautiful work and they're getting lots of work. When people tell me I can't find work in yoga therapy, I just feel like, oh my gosh, the world needs us. And there are so many people out there that need to understand what we do. We have to articulate what we do. If they just knew what we did, they would invite us in. So
yeah. I'd like to say, I am licensed, but I don't think that had a lot to do with this part because the license thing almost makes you more of a competitor as opposed to not being licensed. Then you are just here offering something that's different and unique. So,
so great. So great. Well, thank you so much for your time today. Thank you for helping us understand what is yoga therapy, what is, clinical healthcare practice, how do they fit together? How can these tools be used? And most of all, this message that our goal as yoga therapists is to get people in balance so they can do the work they need to do with their licensed healthcare practitioner. And those are apples and oranges, right? That we have a lot of really cool lifestyle medicine or lifestyle balance things that can help clients progress.
Thank you so much, Amy.
Thank you, Becky. It's been a pleasure. And if it's okay, I'll put Becky's contact information in the link underneath the video in case you'd like to contact her or have a lesson with her. And I look forward to starting our new mental health and yoga therapy training this January. If you'd like to know more about that, go to www.amywheeler.com. You need to get your application in soon, and we do have a discount for a few more weeks on the program if you do the early bird discount. So thank you so much, and namaste. Thank you.